This is Dr. Kaan at ACL Academy, and today we're going to talk a little bit about gait patterning, but also more so how we can help keep the knee straight while standing and walking and utilizing that extension during our gait pattern. Before I get further into this, if you guys have been following along on our channel and you find some value here, please subscribe to it. Please like the video. Questions or comments after the video, drop them below. More importantly, share with a fellow ACLer. They could benefit from these education and tips. So a big complaint that I get from people early on in the process, 3 weeks out, 4 weeks out, sometimes even further out, is they're getting their extension back, especially when they're sitting or laying down. But when they go to stand up, or they go to walk, their knee's a little bent. And this could be due to a couple different reasons. One is if you have the available range of motion, that's the first step. Second is, do you have some quad strength, some quad activation? Are you able to squeeze that quad to generate some force to keep that extension? And the other area is just habit forming, right? When we get injured like this, we offload the leg and we utilize the other side more and more. And in order to offload that leg, we keep our injured leg or surgical leg bent. So we have to kind of work our way out of it. How we combat this is daily extension work. So with our clients, every day they're doing an extension program where they're working passively to stretch into extension, and then more importantly, activating that quad muscle in different ways. So I do quad activation or quad contractions in various different positions. We do them laying on your back, laying on your stomach, sitting, and then of course today what I'm going to talk about is standing, how you kind of work that motion while in a standing position. So a couple things when we are first learning to do our standing work, or when we're just standing in general, where I'll see people do is, let's say if this was my surgery side or injured leg, they'll kind of shift their weight here, and then what happens is this leg gets bent, and subconsciously we don't even think about it, and we're not really utilizing that leg, we're offloading it. And right now, none of my muscles are really working. I have barely any weight through here. So number one, we have to make sure that when we are standing and we're not thinking about our leg outside of PT, that we're nice and even, equal weight both sides. Okay. Now, in order to work some standing quad activations, usually what I like to do is just without resistance first, let this knee slide forward, and then you're going to get a good squeeze back. We're going to hold this contraction just like we would a regular quad set, like laying or sitting down, except now you're standing. So we're going to let it bend forward and then squeeze nice and tight. So you're going to hold this contraction 3 to 5 seconds or longer, depending on fatigue, and perform reps. As this gets better and better, what we're going to do is add some resistance. So you take a TheraBand like this, and you're going to tie it to something. I'm going to use the bench here just because it's easier to do. And basically, you're going to utilize this band to provide some resistance as you perform that specific quad set. So how that would look, the band should be positioned just around knee height. You're going to place your foot in it, and the band should go onto the back of the knee. Okay, so now you're going to get some good tension from the band itself, and basically you're going to stand with equal weight both sides. You're going to shift a little bit to the uninjured side so you can offload this leg slightly, and then you're going to let the band pull your knee forward, and then same thing, we're going to pull back. This is called like a terminal knee extension, but it's resisted with the band. Same thing, 3 to 5 seconds, and then let it go. As this gets better, you can go up in band resistance. This way you can get some more power behind your knee contractions. But now you can help with the gait pattern. And how this would work is the other leg's going to come forward a little bit, and this leg's going to be slightly back. So it'll mimic the proper gait pattern where if I were to advance this leg, I'd be taking a step up, right? My knee would bend. But this position, right before my knee goes into flexion, right before I advance the leg, is where the knee is going to be the most straight, okay, like with the most extension there. So we're going to let the knee bend here, come up onto our toes, and then we're going to push back. So now we're getting a little bit of glute activation as well as some quad contraction here, okay? Then you're going to come up onto your toes again, and then same thing, hold 3 to 5 seconds, see if you get a really, really nice, tight, solid quad contraction here. And this is going to help as we go into gait. Now, how to work on the gait pattern a little bit more specifically now without the band. So we're going to do what I call a gait rocker. So again, if this was my surgical leg here, I'm going to pretend like I'm taking a step, getting into my gait pattern, and then I'm going to rock back. Okay, so this would be as I strike. When you strike the floor, this is my indication to say, okay, my quads need to start activating. So I get a good squeeze here, squeezing quad, and then as I hit with my right leg, my left leg starts to go into, we call it a heel off, and the knee starts to bend. And that's when my quad unlocks. So we're going to rock back and forth. Land here, quad squeeze, unlock. Okay, and as you get good with this, you'll be able to go back and forth quickly while thinking about activating your quad muscle. Heel strike, quad squeeze, unlock. And when I unlock my quad, let's go. So usually what I'll train is when we're working on quad activation, extension, gait pattern, we will do our passive stretch first. So that's like a bag hang that you've seen in one of my previous videos where we do a nice stretch. And we follow that with a lot of quad activation. So we'll do quad sets, laying down, sitting, and then these two variations that I showed you standing. And then you can incorporate an exercise like this, which is a gait rocker. And then after that, you would actually go for your walk. So this is a way that you can incorporate not only extension work, as well as you're training your gait pattern. So you have the passive stretch for the back hang, then you go into quad activation, right? So you're doing, first you stretch the tissues in the back, then you activate that quad muscle to use that newfound range. So that's in laying down, sitting, and then if you want to kind of work and carry that over into standing and walking, you work in the standing quad activation ranges, starting with no resistance, then adding a TheraBand resistance, then doing a staggered stance to help with the gait dynamics, then coupling that with a gait rocker exercise that I just demonstrated. And after that, you try to walk a limited amount of distance with a good gait pattern until you fatigue. So this is the way that we do it. Another thing that I do like to utilize when we're trying to gain extension and help our walking pattern is some retro walking. And I have a video of that posted on our channel, so see that as well. It's another thing you can incorporate. So hope you guys found this video helpful as far as extension work and gait mechanics and kind of working on that standing extension as you're learning how to re-walk again. If you have some questions or comments, drop them below. If you found this helpful, guys, please like the video, subscribe to the channel, and more importantly, share with a fellow ACL that can benefit from his education and tips. See you guys next time. We drop a video every Monday here on our YouTube channel.